Hi, Dr. Dave here, Synergy Wellness, Chiropractic and Physical Therapy in New York City. We have a really important case that I want to go over. I've been seeing Luis here for several months, and he is a really, not a unique case, but a very severe case of occipital, facial, and trigeminal neuralgia, all three at once. And for those of you that have had Bell's palsy, which is the facial drooping, we've done some videos on that in the past. It's similar to that in the sense that the facial nerve controls the muscles in the cheek and the eyelids and among other things. Also sensation into the face, into the scalp and the head. But why don't you tell people, when you saw me originally, when you came in, what you were dealing with at night and just the severity of what you were dealing with. Go ahead and tell us.
Well, it's a very strong pain in this area particularly that doesn't even respond to ibuprofen in most cases.
It doesn't respond to ibuprofen?
No, I have to take very high doses.
Okay.
And it's very localized. It's not the whole head, it's really here. And it feels also down in my upper teeth, in the back. So it feels like it goes all the way down here.
Okay.
So I would say it's this whole area here.
Yeah, when you originally came into me, you had severe headaches. They were keeping you up at night, right? You weren't even getting any sleep at night?
Yes, that's the main cause of discomfort, because there's no way you can sleep through that pain.
And it was pretty much every night.
It was pretty much regularly every night, or maybe skip a night, and then it got better with the treatment. And recently I've had a couple of nights that have been bad.
Recently, okay. Mm-hmm. And how many, he's saying recently because we started probably about 5-6 months ago, when he was just not getting any sleep. He couldn't function. He walked in here looking like a zombie, to be honest with you. He was probably getting, if he was lucky, maybe, 2 hours a night?
Yeah.
Yeah, so we did some unique upper cervical adjusting, also thoracic spine adjusting, and he improved. Why don't you tell people how you did over the couple of months? And we also did cold laser therapy on him, which was key. We'll discuss that in a minute. Go ahead.
No, I did much better. Definitely the nights that I had the pain were reduced to practically zero.
Zero.
I didn't have them for weeks, maybe months. Occasionally, if I had a particular day that was maybe I did too many things or whatever.
A stressful day?
I would, yes. Or a stressful day at work, yeah. Could trigger some of it, but it wasn't as bad. So I thought it was gone, but yes, recently I've had a couple of nights that have been very strong.
Okay.
And reminded me of that.
Okay.
But yeah, there was a long period that I was feeling very happy because it was not happening at all.
So how many years prior to seeing me, how many years were you having these severe migraines and the facial pain?
I go back, and I think it's the maximum would be between 1.5 years to 2 years.
So about 1.5 to 2 years, getting a couple hours, if he's lucky, of sleep a night. Severe headaches, severe tooth and facial pain on the side. It took us a few months, but we had him pain-free, headache-free, and then just recently you had a little relapse, right? But what he's suffering from right now is the facial nerve seems to be inflamed, and we're going to do a couple of tests, and it's kind of hard to test with the mask off because I need to do check facial muscles, but we're going to try to work around that. But I already know from his previous diagnosis that's what's going on. Whether it's stress related or he's working on the computer a lot more than usual. He's always worked from home, right? That's
Yes.
nothing new for you. So we're gonna have to do another round of laser treatment over the facial nerve. But he was about to go to get a. Why don't you tell?
Well, I kept thinking that it may be related to a tooth, the tooth number 15, because it feels it goes all the way there, and I thought, well, maybe it is the tooth, the source of it. I do have some discomfort in that area. I had an implant there, and it was not always 100% cool, but it wasn't painful.
Mm-hmm.
The difference is that is when this pain happens, it's like very strong.
And the key here, sorry to cut you off, the key here is his pain. When he told me his pain gets worse at night when he lies down. Not necessarily, sometimes when he chews, but not necessarily, but at night when he lays down. If your tooth pain gets worse at night when you lay down and you have headaches or neck pain, it is most likely, facial neuralgia, okay? And it could get worse, and it could cause Bell's palsy and drooping of the face and other issues. And we want to nip this in the bud. We already dealt with his occipital neuralgia, which was causing a lot of headaches for him. And now there's just some lingering irritation to that facial nerve. And we're going to check the trigeminal nerve as well. And you're having a little bit of a headache in the back left of the occiput there, right there?
Yeah, it's right here.
Okay, so I'm going to show you what we do here. The laser treatment, you can tell him, does it hurt?
No.
You don't feel a thing,
Not
do you?
feel it.
Yeah. Okay, so go ahead and lay down on your stomach. Each treatment takes just a few minutes, and very safe. There's no side effects. There's none listed by the FDA, and it's really great for any kind of neuralgia. It inhibits the nerve, calms the inflammation down, and that's exactly what we're going to do. So since it's on the left side, we're going to switch over to that left side. And I'm just going to test some areas out here. Are you tender here? Here? Here?
Yes, I'm not terribly there.
There? Okay. And there? So could you imagine having so much pain, getting an hour, 2, 3 hours max sleep a night, and then trying to wake up the next day and function and work and be effective at your job and your work, and it's pretty depressing when you go almost 2 years without help. And what did you do for those 2 years? You must have tried medications and...
Mostly I was trying to use non-steroidal drugs for the
over
pain.
the counter stuff?
Yes.
Okay. Anything else?
I tried massage,
Okay.
like Swedish massage, and to be honest, it didn't make much difference.
Okay. So for those of you that didn't hear, he tried massage, over-the-counter, non-steroidal anti-inflammatories like ibuprofen and Advil. None of that worked. Some of the more invasive things are some of the more heavy narcotics are Imitrex for migraines, and oftentimes those don't work either. Headaches are really, really easy for chiropractors to fix. And when I say fix, I mean to get to the source of the headaches and correct them so they don't come back. And for the most part, he's been great for for all of this year until the coronavirus hit. You were stuck at home a little bit more, right? It's kind of when it started up in a couple months in.
Probably yes, because it's. I remember only 2 episodes in the last 3 months.
Okay, so he's had 2 episodes, 2 headaches in the last 3 months. And the tooth pain, has that been more consistent?
The tooth discomfort is there, but not the pain. The pain happens together with the head pain.
Okay. So the tooth discomfort was really bad. When you first came in, we calmed that pain down. It got less, and then it's increased a little bit with the headache, is what you're saying?
Yes.
Okay. So he's just having a little flare-up right now, and we're going to get that under control. A lot of neurologists would never send this patient to a chiropractor. And the fact is, chiropractors can change brain activity, the sensory input into the nervous system directly. A neurologist can't even do that. Now you know. Now you guys are in the know. If you have any kind of neurological disorders or a sciatic nerve, that's a neurological disorder. It's just a lumbar plexus nerve. Then you have your brachial plexus up here, which controls sensation down into the arms, hands and fingers, the lumbar plexus down into the legs, hips, feet, and toes. And then on the upper brainstem area, you have C1 and C2 vertebrae that surround the brainstem. And that adjustment is probably the most powerful adjustment because it really literally changes brain function. And we've seen that on studies and research papers time in and time out. Tuck your chin down for me. We're going to have him sit up in a minute here, and we're going to go along the path of the trigeminal and the facial nerve and the occipital nerve. And we'll just get under his hair here for the occipital nerve. I'll show you that from here. How do you feel?
Good.
You don't feel a thing, do you?
No, just the touch.
Yeah. So you don't want to do this through clothes. Preferably, you'd like to do it right to the skin surface. If you do have to do it through clothes, then you want to do it through light colored clothes. White or very, very light colors. Okay, and we're going to go up here. So the occipital nerve runs up through here on both sides into the occiput. It's always been your left side, right?
Yes.
And his headaches, his facial pain has always been left-sided. So a mixture of cold laser with upper cervical chiropractic care. When he first saw me, this middle back area was very tight. We've got him doing stretches. How are those going, by the way?
They're going good.
Okay. A little bit tight right
Well,
through here.
it's because in part I had a bad night.
Yeah. Did you get any sleep last night at all?
Late. Very late.
Did you take medication?
I did take hydrochloroquine.
Okay. Did it help?
It helps. It helped me through it rather than being...
So it helps you get a little bit of sleep?
Yes, but it didn't really help me until very late.
Okay.
3, 4 a.m. Which I tried to
Okay.
avoid.
I'm gonna have you sit, you know what, instead of sitting, I'm gonna have you lay on your back. You can go ahead and turn over on your back. Okay, so the facial nerve kind of branches out into the cheek area here, trigeminal nerve and occipital nerve up into here. So we're gonna just go over those roots. We can do that with his face mask on. And I would say probably in about 5 to 10 laser treatments, his tooth pain should be gone. He should notice a difference after 1 or 2 laser treatments, but we should really be able to get him through this with a handful more laser treatments and nip this in the bud finally, so he doesn't have any more relapses. And we've got him about 90% of the way there, 95% of the way there, so. Okay. Now you might feel a little bit of sensitivity here when I touch it. Doing okay there?
Mm,
You haven't had any problems with your eyes or tears in the eyes?
no.
Like dry eyes, anything like that, or any twitching in the eyelid or in the face, facial muscles, the cheeks, anything like that?
No.
Good. And you'll see here that I'm going up a little bit higher. We want to get all the branches because once it reaches right near the ear here, it branches off into several different branches. And he's had neuralgia of all 3 nerves, the trigeminal, the facial, and occipital. So we want to make sure we touch on everything here with him and that we're thorough. Okay, now we're going to adjust him. I'm going to have you lay on your stomach, Luis. When I first got my hands on Luis here, he was very, very difficult to adjust. It was like adjusting through a brick wall. He's much better. He's done a really good job of stretching at home, and with a little bit of direction, he was able to really loosen this area up, and a little bit of help from me. Go ahead and raise, so you're going to lay on your left side. You're going to face that way. And relax yourself. Good. And the other side up. Remember how stiff you were when you first came in? What are you doing now for exercise? Are you running or anything like that?
Not running.
Okay.
Walking.
Walking?
Fast.
Okay, speed walking. All right, take a deep breath in and blow all the way out, and just relax here. Good. On your stomach. Take a deep breath in.
One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you. Appreciate all of you.